Well, you would have to be living under a rock if you haven't read any of the recent media or the news reports about the obesity epidemic that we're all facing throughout our entire country. I know many of you are not up late at night Googling TED Talks on obesity as I am, but I am sure that many of you have understood that we are in a severe crisis of how we eat and how much activity we are not getting. I'm representing Lighten Up Lancaster County. It's a community coalition made up of 1,800 members, multiple businesses, schools, families, parents, elected officials, all working to increase the number of individuals maintaining a healthy weight in our community. It takes one step by each individual to begin to change the community for the good in which we live. People think that they're unable to contribute to the health of our community when in fact, just by making simpler choices yourself, you're able to work towards the greater good of our health of our community. This picture here shows the local Barnstormer stadiums. It shows 43 stadiums that would be filled with the amount of individuals in Lancaster County who are overweight or obese. That makes up about 64% of our population. And we're not just talking about adults, we are also speaking to the epidemic among children. 1/3 of our students, young teenagers, are struggling with this problem as well. This map is not a map of many different highlights or cities in our country. This is actually the McDonald's alone. This shows you where McDonald's has set up shop, and the highlights where the density of people live as well as the number of restaurants. This isn't Taco Bell or other restaurants, McDonald's alone here. And we begin to understand how the food industry plays a part in making unhealthy foods available for us at very quick, affordable prices. It's oftentimes cheaper in the research I'm doing to drive through the McDonald's drive-in for a family of 4 to feed their family for a dinner meal than it can be to order or to cook a healthy food at home. Many of you would have had the chance to see this campaign that we recently ran in Lancaster County that talks about how we all need to rethink our drink. This sign was actually hung above, a billboard hung above a McDonald's billboard right out here in the corner, and many of your students and other people commented about how we would never drink 22 packets of sugar in one sitting, but we're very quick to do that if we're drinking a bottle of soda. We need to start rethinking what we're putting in our mouths. Not only is our diet crazy, but our kids who used to play outside until mom called or said, guys, come on in, it's supper time. Our kids now stay in most times because of perceptions of safety, lack of people that they can trust to be out at the parks and playgrounds. And so we have this perceived notion that our kids need to be caged up inside, going through screens, playing video games, watching computer and TV programs, whereas the perceived notion of kidnappers around every corner is not the case. In fact, we hear the Amber Alert in California, and it causes this fear inside of us when actually most of kidnappings are caused by a family member of an individual. So we've begun to fear letting our children to go out and play in normal settings. Not only are our families and our children experiencing challenges in their environment, but this is, if any of you have traveled at Route 30 or 222 on your way home from Lancaster County, you will find traffic. You'll find that we have designed our communities for cars and not for the person who would like to walk or bike, or even a disabled individual who would like to get to and from a destination. So what is going to turn the tide as we look at the environments for which we live? Right now, most times it shows us that our zip code can really affect our health and how we live, work, and play. It's going to take collaboration like these individuals here at one of our local elementary schools that have decided it's important that kids understand how to grow produce, that they understand if a food is grown in their garden and they try it, most times the children will prefer that vegetable, and they take it home to mom and say, Mom, let's buy this at the grocery store. Personally, I've been on a journey of understanding how we speak to those most vulnerable in our community. Normally, I've had the way of walking into a community, looking up a best practice and saying, we want to come in and provide this for you, let's do it, let's build a market, let's come in and do a best practice strategy, and not asking the individuals, what would work in your community? What would it take for you to have a healthy community? And so we've switched our initiatives to be able to talk to people, to hold focus groups. We've recently held 4 focus groups where we ask community members, what are you doing already in your community to be a healthy family? What would it take for extra resources to come in, and what would work if we tried to do something that would create health in your community? And we've listened and we've heard, and it has been wonderful to have the feedback of the members living in those communities and then identifying champions. All of Lighten Up Lancaster is made up of individual champions who've said, I am going to take on this cause. I want a healthier generation. Right now, research shows that we are facing, potentially this generation will not outlive their parents due to the onset of early chronic diseases such as type 2 diabetes, heart disease, and cancer at very, very young age. I want to talk today about the businesses who have understood that the health of their employee is so valuable to maintaining a work-life balance. Here we show a business who offers free yoga classes to their employees because they realize if they're stressed or anxious or depressed, they're not going to do a great job on the job, and most likely they can have high absenteeism rates. This company in our local area has chosen to do stand-up or treadmill desks in their office to be able to get their employees from sitting. The research shows right now that 80% of us have sedentary jobs, and if we sit all day, and even if we get activity at the end or beginning of our workday, we're still prone for the same risks of chronic disease because of the hours and hours of being sedentary throughout the day. We have been looking at ways to engage our refugee population in Lancaster County. Franklin and Marshall is one of the leaders in that area, and we work with one of the retired professors, Dr. Carl Pike, who could be out traveling the world, enjoying his vacation time, but he has been a volunteer with us and looks at how we can increase the number of school and community gardens throughout our community. Here is one local example of how our refugee population will harvest and care for the garden while the children are out of school during June, July, and August. So we are growing the vegetables that the refugee population has asked for, and then they'll care and maintain the garden when the children aren't there. We've begun to look at how we can help our municipalities, boroughs, and townships design their communities for health. So as I spoke earlier, when you design for cars, you get cars. When you design for people, you get people. And so right here, we work with our partner who provides in-kind dollars to do walkability audits with our municipalities. An audit is just a simple tool that we use. We go for a walk with community residents and leaders led by this engineer, Ben, a design professional who offers his time in kind and writes recommendations for policies and short-term small implementation projects that these municipalities can do to have a safer place for their residents and their businesses to walk. And I would be remiss if I didn't mention the bearded wonder, Chris Caldwell from Commonweal. He's taken over Reservoir Park in Lancaster and made it a place that is actually doing youth intervention work by teaching children how to care for and earn a bike. Through his Earn a Bike program, he has worked with countless children who could otherwise be identified as children who would be at risk and end up in our juvenile detention centers. But because they're learning how to care for a bike and use it, they'll actually have a mode of transportation that's free and affordable when they start commuting for work and other places in transportation. The Lancaster Rec Commission has been an amazing partner with how they begin to engage our community, even for those who many events are not planned. This event here is called an Open Streets event. They're happening across the country, and it's a way to get city streets shut down and have families and children running, biking, playing, dancing out in the streets so that they can try to ride a bike in a safe environment, go for a walk, and have fun while they're being physically active and learning how to eat healthy. The chef behind the students in this program is just another example how when we began to educate the women and men who lead our food banks for our most vulnerable, and they were fed up with giving the white bread and the leftover pastries as parts of meals that they were offering to our most vulnerable, they've decided to change the way they do community meals. They're looking to get new farmers' produce. One school is working with the food bank to give them the produce in their school garden and to put it on the meals that are served in the Columbia area. Chefs like Vicki are changing the way our children learn how to eat. And I would be remiss if I did not mention the partnerships at Franklin and Marshall. I have benefited countless hours from the F&M Ware Institute intern program, multiple interns that come out of the Ware Institute and then actually stay and affect our community. They start businesses. They're excited about Lancaster and the change that they offer. And I've been honored to work with the PIT program, putting it all together, and the incoming freshmen, just as they learn what Lancaster County is all about and how they can become a voice of change. Pennsylvania College of Art and Design and Millersville have as well contributed to the health of our community by students like this designing, who are graphic design professionals. They have designed multiple forms for us. They have designed logos and informational pieces. By using their time and in-kind hours, it has saved us thousands of dollars by using their students and how they can affect our health in our community. If you haven't yet visited Central Market, the hub of Lancaster City and of fresh, local, affordable food, I ask that you stop by Sue, otherwise known as the Turkey Lady, and talk with Sue as she has begun a champion to look at how we have access for those who cannot afford normal produce and things like that in the market. So she has single-handedly taken on increasing the number of EBT or SNAP. The old terminology was food stamp program, that they would be able, people who need those subsidies would be able to shop at market. And so there's an entire strategy around community engagement, diversifying the market so everyone feels welcome when they walk through our doors. I will leave you with this as you begin to think, where is my voice? How can I make a difference? We ask you to think through one small, simple thing, an example that I shared today, or other examples of how you can use your time to volunteer. You can make healthier choices in your cafeteria. You can say, I'm not going to serve donuts at our faculty meeting today. I'm going to provide a fruit basket. There are such small changes that you can do. So we leave you with, will you speak? Thank you for your time.